Hello, everyone. My name is Monica Johnson-Hostler, and I'd like to thank you and welcome you for attending our webinar on advocating for survivor services and prevention with Congress. It is my pleasure to have my colleagues walk you through ways that you can continue to be active participants in how what you do in your local communities and your state level communities definitely impact the way that we move our federal advocacy forward for all the federal funding sources and substantive legislation that we are doing on behalf of you by you sharing the survivor voices that you work with to inform our policies. It has truly been a great experience for me to continue to work with all of you and to know that there are over 1,300 rape crisis centers and 56 state and territorial coalitions that continue to be partners in advocating for survivor services and prevention at the federal level. At this time, it is my pleasure to turn it over to my colleague.
Good afternoon, everyone. I'm Terry Poor, the Policy Director at the National Alliance to End Sexual Violence, and I use she, her pronouns. We're going to start today by enabling our Spanish interpretation. So I'm going to turn it over to Vanessa to just explain that to you.
Hello, good afternoon. Today's event will be conducted in English with Spanish interpretation. There is also ASL interpretation. These instructions are for accessing Spanish or English interpretation. Anyone who is not Spanish-English bilingual will please need to select the language channel. To listen on a computer, locate the globe icon along the bottom row of your Zoom screen and select English. If you are joining via the Zoom app on a mobile device, click More or the three dots in the corner of your screen, select Language Interpretation, choose English, and then click Done. And please don't select Mute Original Audio. Hola, buenas tardes. El evento de hoy se llevará a cabo en inglés con interpretación en español. También hay interpretación en lengua de señas estadounidense, pero estas instrucciones son para acceder a la interpretación al español. Quien no sea bilingüe en inglés y español tendrá que, por favor, seleccionar un canal de interpretación. Para escuchar el español desde su computadora, haga clic en el icono del globo terráqueo en la parte inferior de la pantalla de Zoom y seleccione su idioma. Si se está conectando a través de la aplicación Zoom en un dispositivo móvil, haga clic en More o en los tres puntos en la esquina de la pantalla, seleccione Language Interpretation, luego elija su idioma y haga clic en Done. No seleccione Mute Original Audio. Thank you. Gracias.
Thank you, Vanessa, and thank you to all our interpreters today. In addition to ASL and Spanish, we also have live closed captioning, so we hope you'll make use of that. And we're glad you're here today. And let's get right into it. On today's webinar, we're going to talk about our toolkit for advocating for survivor services and prevention with Congress. We're going to provide some key issue updates so that you have some content information for your meetings with your members of Congress and their staff in district this April during Sexual Assault Awareness Month. We're going to lay out a timeline for advocacy, a suggested one that you might want to follow. And then Ellen Fern from our Government Affairs team is going to provide some Advocacy 101 information. We have a couple of wonderful guest speakers who are coming today, and then we'll end with some talking points and key asks. So let's get right into it. Okay, so we wanted to share our website so that you can see where you might find this information. So Maureen from our team is going to share our website, and I'll talk you through where you can get all of the handouts, documents, toolkit pieces that you might need to set up these meetings. So if you go to our website, endsexualviolence.org, and you click on the, we'll just give it 1 second. Yeah, sometimes it's hard to see the tabs when you're also sharing your screen. So if you can share the, there's an Advocating for Survivor Services and Prevention tab, which might not work with the heading, I'm thinking. Okay, well, we can pause this part and come back to it and see if it'll work later. We will move right into it. But rest assured, on our website, endsexualviolence.org, you can reference all of the materials that we'll be talking about today, the toolkit, the infographic, and all those pieces. And additionally, Liv's dropping those pieces in the chat, so you'll have them readily available to you. All right, let's go to the next slide. So I'm going to talk today about some key issues and updates about the issues we care about. There are many, many policy issues related to sexual assault and sexual violence that we could all be working on at the state and federal level. But we're focused today on some very important federal funding sources that fund survivor services and prevention that almost all local programs and survivors rely on. And those are the Victims of Crime Act, or we call it VOCA, the Sexual Assault Services Program, affectionately known as SASP, the Rape Prevention and Education Program, RPE, a brand new sexual assault demonstration initiative that we're proposing at HHS, and then the American Rescue Plan, or ARP, sexual assault funding that is gone out to rape crisis centers. So we'll touch on each of those today. We're going to touch on them pretty quickly, but know that you can return to those handouts that you're seeing in the chat for more information on these topics. So almost everyone's aware of VOCA. VOCA is incredibly important. It funds not just sexual assault programs, although it funds almost all sexual assault programs in the country, but also domestic violence services, children's advocacy centers, and victim advocates at law enforcement and prosecutors' offices. And we know that the Crime Victims Fund has been a longtime non-taxpayer source of funding. Unfortunately, we've seen significantly decreased deposits to the fund, and so we are now experiencing a significant cut to VOCA. In FY24, VOCA was funded at $1.3 billion, which is down about $600 million from $1.9 billion in FY23. So a very significant cut we're all very concerned about. I know we've all been talking a lot with each other at the national, state, and local level about what advocacy is needed to ensure Congress invests in VOCA and goes back at least to the FY23 funding level of $1.9 billion. So we're all working on that together. Several years ago, we worked on the VOCA Fix Act, which passed, and it made a big difference, but it wasn't sufficient. So we need to keep working on it. In FY25 also, and we can go to the next slide here, Maureen, the president recommended a infusion for VOCA over the next coming years of $7.3 billion. So while that's very exciting, we know that now really for FY25, the appropriations process is in the hands of Congress. And so whether or not Congress will choose to enact that proposal from the president's budget is something that's up in the air and would take congressional action. In terms of hopeful sources for VOCA, we know that there was a settlement from Binance, which is a cryptocurrency company, a major settlement by the federal government, and over $1 billion, $1.5 billion from the Binance settlement will go into the VOCA fund. So that's good news. We also are looking at revenue from the False Claims Act as a possible place to look for additional revenue for VOCA. And we have the president's budget proposal. So we are looking for new ways to fund VOCA. Our key message to Congress this year, as it was last year, is that Congress really needs to find a pathway to build up the Crime Victims Fund until it can sustain at least that $1.9 billion, because victim services really rely on that fund. Another really important federal program that we rely on through the CDC is the Rape Prevention and Education Program, or we call it RPE. This is a funding source created in the first Violence Against Women Act in 1994, designed to fund local programs and state coalitions to do primary prevention work, the primary prevention of sexual violence. In FY24, which just was completed, RPE was funded at $61.75 million. We're requesting, and we're asking you to request, $100 million in FY25. And the president's budget also requested level funding at $61.75 million. Both in FY24 and FY25, there are budget caps. Congress is operating under the Fiscal Responsibility Act. So level funding in this environment is actually quite a win. So while we are asking for $100 million, we do think getting level funding in FY24 was good, a good result. Okay. The Sexual Assault Services Program is another formula grant program, and formula grant program means the funding goes out to the states and then the states administer that funding to local programs. And SASP, created in 2005, is a designated federal funding source for sexual assault services. In FY24, it was funded at 78.5 million, level funding with FY23. In FY23, we got a pretty big increase, so that was good. Again, for this program, we're requesting $100 million for FY25, and the president's FY25 budget has $90 million. So the president also recommended an increase in this program. So that's really good. And then we have a brand new idea that we're pursuing, both from an appropriations standpoint, and also we're looking to see legislation introduced, a sexual assault demonstration initiative at HHS at the Office of Family Violence Prevention and Services. So we are really wanting to see support for a comprehensive and collaborative service delivery for adult survivors of childhood sexual abuse and sexual assault survivors to work with healthcare systems, mental health, substance use, healthcare systems, all those pieces to really make sure survivors are getting their needs met and that those systems understand the needs of sexual assault survivors. So we're requesting $30 million for this brand new project. And then last but not least, we know that the American Rescue Plan sexual assault funds have been incredibly important to help rape crisis centers get through the COVID pandemic, but also that we need those funds to continue. So in 2021, there was a historic investment of $198 million through the Office of Family Violence Prevention and Services. And we know those funds are now in the field, meeting the needs of survivors, and are incredibly important. But states only have until the end of FY25 to spend these funds. And so we are really think it's important to talk about how important these funds are and how important it will be to find a continued funding source so that these funds don't run out permanently at the end of FY25. Okay, so those were our main content issues: VOCA, RPE, SASP, the HHS Demonstration Initiative, and the American Rescue Plan ARPA funds. Now we're going to talk a little bit more about setting up your meetings and how do you interact with Congress on these really important issues. So we have this proposed legislative advocacy timeline. Obviously today you're participating in our prep webinar, which is awesome. We're recommending that in the next week, you go ahead and request your meetings, and you're about to get a lot of good information about how to do that from Ellen. And then we recommend you spend the next week gathering your materials. And if you have multiple people attending your meetings, which you very well may, do a prep call with them so that you all know which order you're going to speak in and all that sort of thing. We'll talk about that more soon. And then we're recommending that you hold your meetings on April 24th and 25th or around that time. It's really great that members of Congress are home in district on recess almost every year during Sexual Assault Awareness Month, which is, we're on day 3 of Sexual Assault Awareness Month. And so we find like this is a really great time to talk to them at home when they're really caring about their local programs and what constituents are dealing with. This week during recess, the first couple days of recess begin the Passover, Jewish Passover holiday. So we've recommended that you start those meetings after the holiday, and that's why we've suggested April 24th and 25th. But again, any time around then will be great. And then we recommend that you follow up after those meetings by May 6th, the follow-up email, provide any information that's been requested. And then we never feel like it's a one and done with meeting with staff and meeting with Congress. We feel like it's important to build that ongoing relationship. So we recommend that you think ahead to August, when again, Congress will have a recess and be home in district, for another way to interact with your members of Congress, whether that's a tour or holding an event at your center, but thinking in terms of August for the future. Okay. Okay, so before we jump into Advocacy 101, we have a poll for you. So we're going to do a poll. It's one question, and we're going to hope that everyone will participate. And also, please feel free, I meant to mention this in the beginning, that we will have a question and answer section at the end of the webinar after the material. And please feel free to use the Q&A function, and we will definitely get to your questions, whether somebody's able to answer them in a written format or verbally at the end. We'll make sure to get to them. So this question, have you met with members of Congress or their staff before? And it looks like we're at about 50-50, which is wonderful because we have some experienced folks who have done this before, but then we have some folks who haven't done this before. So we're really super glad to have you here, maybe learning this information for the first time, and really want a big takeaway from today to be folks feeling empowered to set up those meetings with their members of Congress. You're the ones who vote your local representatives and senators into office, and we really hope that you'll take advantage of this information to set up meetings on issues that you care about. Okay. So we wanted to just share a note about the question of lobbying before we get into the advocacy nitty-gritty. And because these questions come up all the time, and I'm gonna, after I stop talking in just a second, I'm gonna drop into the chat another resource from Boulder Advocacy on this issue as well. But folks always ask, like, hey, it seems like you're talking about lobbying. First of all, I wanna say you can do all of the things that we're talking about doing today in a way that's not lobbying. And I'll say a little bit more about that. But also 501c3s, nonprofit organizations, can lobby. They can only use a certain percentage of their funds to lobby, but they can lobby. It is okay, but you can't use grant funds to lobby. And I think we all know that. Individuals can also lobby. So you could always take time off your job and go as a personal citizen to talk about any of those issues. That's perfectly acceptable to do that. But also educating policymakers about your program and the needs of survivors without taking a specific position is not lobbying. So you'll see on this webinar, we talk about making a specific ask. But you can go and meet with your member of Congress. You can talk to them about these programs. You can talk to them about what you need in terms of prevention, what survivors need, and you can leave out the ask. And that is an educational meeting. That's not lobbying. So we thought it was important to take a minute to talk about that. And now I'm going to turn it over to Ellen, and she's going to jump into talking more about the nuts and bolts of advocacy, setting up your meetings, and all those pieces.
Thanks so much, Terry. Hi, everyone. My name is Ellen Fern, and I use she, her pronouns, and I'm excited to talk to you about some hints and suggestions for effective advocacy. As Terry was just talking about, advocacy really, to me, is about educating policymakers, their staff, about what you know best. You are an expert. You are the expert on providing high quality services for sexual assault survivors and prevention services. Policymakers can't possibly know every detail about every issue. And that's why advocacy and our system of government is so important, because our system provides us the opportunity to go in and educate about what's going on in your community, what you and your colleagues do to meet the needs of survivors, and to then offer yourself and information as resources to make that policymaker's job better. And so he or she can better represent the needs in the community. Advocacy is really rooted in mutual respect and trust. You're building trusted relationships, right? We can have different opinions on issues, but we can hear each other. We need to strive to share information, respect each other's views. But the best we can do, the most effective thing we can do, is give good, sound information and be that critical resource, that go-to person. This really is the best foundation for really effective advocacy. Next slide, please. So when you're requesting a meeting with your elected official, it's very easy. You want to go to the office that's nearest to you, and you can we have here on the slide the websites for the Senate and House, where every member has their own website and contact information about how and where to contact the office so you can request a meeting. If you're requesting a meeting with a member, him or herself, you'd most likely I recommend calling the office, asking for the scheduler, and he or she will tell you how best to communicate your request. You might be able to just make the request on the phone, or they might ask you to send in a written request, what office you would like to meet at, and when you might be available. And then so you'll make that request, going to making that call, and then waiting 3 or 4 or 5 days. If you don't hear back, it's perfectly fine and expected to make a follow-up call or email to try and lock in a meeting when the member is home back in the district. When you request your meeting, if your member is unavailable, because he or she, when they're home, they're very, very busy, the scheduler or another staff person might make a recommendation to meet with a policy aide, a legislative assistant, a staffer, which is perfectly wonderful, is a wonderful opportunity, just like meeting with that member. Policymakers have staff that cover specific portfolio areas where he or she is the expert in a series of issues and reports up to that member of Congress. And so meeting with a staffer, establishing a relationship with that staffer, providing information and your expertise is really a wonderful opportunity. And if you don't know the staffer's name, the scheduler, whoever you talk to in the member's office, will point you in the right direction. But please know that if the member can't meet with you, please go ahead and make that meeting with the staffer, because staffers really do all the work. Next slide. An important thing when you've got your meeting schedule, you want to sit down before you go to that meeting to plan it, to make sure you're going to make best use of your time. You're going to think about who's best to attend, perhaps 1 or 2 staff from your program. Maybe you have a survivor that would like to go and share his or her experience. Maybe a business leader, a board member. Think about who you want to be in that room, and think about the materials you will want to bring with you. At the top of this webinar, Terry showed you and talked through, and we've put in the chat, thanks to Liv, all the materials that the National Alliance to End Sexual Violence have put together about the issues. But your own materials, your own information about your program, what's going on in your community, will be so appreciated. So make sure to bring some your own materials with you. You're going to, before you get into that meeting, think about who's going to say what, who's going to make the ask, who's going to explain, and what's going on in your community. I highly recommend that if there's 3 people in the meeting, each of you have something to say and to contribute. And also, it's important to be prepared when you walk into that meeting. What background information do you need to know about the elected official, the policymaker? What committees does he or she serve on? How long have they been in office? What party are they from? Maybe you can also go through their press releases, which will be on their website, to learn a little bit more about how he or she votes. What are the priority issues? And you just really want to be as prepared as possible about what you want to say and what you want to ask, and also about who you're going in to meet with. Some things to expect. If you have a scheduled meeting with the member, him or herself, the member might not stay for the whole meeting. That's because he or she is trying to meet as many people as possible while they are home during recess. So they might be come to the meeting for 10 or 15 minutes and then have to jump out. That really, please don't feel insulted. That happens all the time. They're very, very busy, but they want to come in, they want to meet you, and then they'll leave staff there to finish the meeting. So don't be surprised if that were to happen. It could also happen that you think you're going to meet with a member and you get there and something's come up in his or her schedule, so you're just going to meet with a staffer. Also, that is completely normal. Maybe they also have to change the location of your meeting or the time. Try the best of your ability to just go with the flow on that. It's really not, they're not trying to be rude. It's just that they're just very busy and schedules are always changing. And lastly, some folks may be surprised, some of the staff appear quite young. There's a lot of really young, enthusiastic staffers that work both in the district and the Washington, D.C. office. They are very smart. They're up to speed on everything. And once again, you are the expert. You are the resource. They're going to be so excited to meet with you and learn from you because they just want to be as effective as a possible staffer to their member. When you're done with your meeting, please make sure that there's time to answer any questions staff or the member have. Also, at the conclusion, it's wonderful if you'd like to take a picture with the member or the staffer, but please be sure to ask them if that's okay if you have a picture, and then ask if you can post it on social media later. 9 times out of 10, the member will say, yes, please, because of course they want to be seen meeting and conversing with their constituents, but it's please ask before you just start taking pictures. Also, if make sure you know what follow-up information you promise to send and let them know that you will send it when you're back home. If you don't know an answer to a question, please don't feel like you have to make it up. Please don't feel like you have to know the answer to every question. All you need to say is like, you know what, I'm not sure about that. I want to give you accurate information. I will follow up with that information after the meeting. And lastly, please, I hope you'll consider inviting the member and or staff to see your program, to an event, to keep that ongoing relationship, to keep that dialogue going, to keep them engaged in the conversation you just started during your meeting. And then once you get home, it's very, very nice to please send a thank you note. Thanking staff and a member for his or her time is always something we can agree on. Everyone is busy. And so sending an email follow-up thank you is a perfect way to get in that person's inbox, thank them for their time. Provide any information you said you were going to share. You can also let them know that you posted on social media, if that is something that you posted a picture on. Also, you can also always ask about upcoming town hall events or events the member is going to be at. So you can attend and keep up with what the policymaker is talking about and what his or her priorities are, and be with other constituents who are sharing information to that policymaker in a town hall or other community event. And that's, we're going to stop there now and get ready for another poll on our guest speakers.
Great, Ellen, thank you so much. Before we turn it over to our guest speakers, we do have a second poll for you. So what do you find is the most effective at inspiring policymakers to support sexual assault services and prevention? Data, stories, survivor activists, a program tour, or calls and emails to their office? Okay, and I actually lost the poll, so I can't report about it. My apologies. Maybe I can pull back. Oh, there we go. Oh gosh, over half of you all thought stories. I think stories are so compelling as well. And almost 20% of you all thought data, and also a number of you thought survivor activists. Okay, great. And it doesn't have to be one or the other. We're going to talk about how important it is to weave stories and data and the real lived experiences of survivors together to be really effective. So thank you so much. Okay, now I'm excited that we have two guest speakers to talk a little bit about their experience. Elizabeth as an advocate in doing these meetings, and Andre Lindsay as professional staff with the Committee on Education and the Workforce in the House on his experience in receiving advocates doing these sorts of meetings and what they find to be effective in terms of having meetings about issues you care about. So I'm excited to welcome Andre Lindsay and Elizabeth Newman, who's the Public Policy Director from the Colorado Coalition Against Sexual Assault. And Andre, if you don't mind, I'm going to turn it over to you.
Hi, everyone. Thank you for having me today. So as Terry mentioned, my name is Andre Lindsay, professional staff with the Committee on Education and the Workforce under ranking member Bobby Scott of Virginia 3. So a little bit about me. So I've been with the committee for about 7 years now, or almost 7 years now. This was my first job outside of college. I was an intern, staff assistant, and now I work on the policy side of things. And today I'm really excited to speak with you all because, I think I have a unique perspective where, when I was an intern, I was the one who was scheduling the meetings. Now then as a staff assistant, I was the one sitting in on the meetings. I was taking the notes. I was a fly on the wall. And now I'm leading the meetings, which is somewhat nerve-wracking at times, but also really rewarding for myself. Also, let me back up. I am the policy lead for everything child welfare, domestic violence, child nutrition issues for the committee, and some other things in our health and welfare space. And again, to echo what Ellen said, some staff you meet on the Hill are very young. I think I was 24 when they put me in my first meeting by myself. I may have almost cried, but I got through it. And trust me, we do our background. We try our best to be knowledgeable. But as Ellen said, you are all the experts. We really rely on you all. Really quick, I just want to say anything I mentioned on the call today is my own personal thoughts and nothing officially from the committee. And again, thank you for being here. Really coming to really share your perspectives and your thoughts with us. I thought I'd dive right into really explaining, the importance of advocacy for Hill staff as myself. It really provides that perspective for staff. Because here in Washington, D.C., sometimes we're kind of in a bubble. It's hard to see what actually goes on outside in the districts, what's happening on the ground. So it's really great to always see that, to see those concerns, see those issues. And because to be honest, you all know what works well, what doesn't work well. I am pretty realistic that I know that sometimes the policy we create on the Hill, those laws we have don't really match reality. So we really depend on you all to really convey that to us, and that gives us different angles, different perspectives. I would say for me myself, I think I speak for my other colleagues as well, but like that we really depend on advocacy to help guide us in our negotiations, our bill writing, strategy, oversight. So whenever I'm negotiating with our friends across the aisle, the Republicans, or I'm in a meeting, I'm always thinking, what advocate's going to think? Are they going to be mad at me? Is it going to come across well? Because you all know those dynamics. And oftentimes after those meetings, I'll call Ellen, or I'll call folks and be like, what do y'all think about this? How would that come across with folks in your community? So I think so it's really critical, really helping us to see what's going on the ground, to be honest. And then, I think I'll just dive into, what to bring to the table. I know Ellen really went through about weaving in stories and data and having a balance. And I think that's very critical. A lot of times when we talk about coming to the Hill and conveying different experiences and stories, we really rely on anecdotes and testimonies and stakeholder stories, which is immensely helpful. And I think it really grabs our attention at first, but also too, I think it's really helpful to balance that out with really that data, that research, the evidence, because for my boss, that's really what guides the policy. So not saying that survivor story is not important. It's immensely important and it's helpful for us, but also making sure you convey that with the stats, the research. Because to be honest, on our end, that helps us really, work on our end as well, and work with other offices and stuff. Because once you bring in, once you bring in stats related to someone's district, or or showing how many survivors really depend on a certain resource in the district, it's kind of hard to really fight against that. So we really want to rely on that. And whenever I come to my boss with a policy idea or proposal, he's like, what are the numbers? What's the research on that? He's a big number person, and so we really try to really rely on that. And also that's why I always advise folks that when you're coming to chat with us, you really come prepared with those materials, and knowing who's going to handle that. So you may have one two people who will cover their survivor stories, and then you go into a third person who will talk about the actual research or the stats, or some survey polls from the recent funding we've had. Because again, we really want to see what's working on the ground, what's not working on the ground. And then also I'll just like kind of end with, we love having specific asks, when folks come in to see us, not just to support A, B, and C, but, what bill do you want us to get on? What funding line do you want us to support? In terms of, what regulation do you want us to talk to the department about? What concern do you have? Because it really helps us, especially as staff who have multiple meetings in different portfolio areas, bouncing from thing to thing. It really helps us to really do our research ahead of time, because I do want to be like, knowledgeable before I come into this meeting. So it is helpful. So a lot of times we would do our background, and I'll say that a lot of times when we walk into a meeting and there's a different bill that's being discussed, it kind of throws us off a little bit because we weren't really prepared for that, but we're still happy to discuss. But the more information we have prior to the meeting is always super helpful. So really coming with those specific asks, if you're talking about a bill, please come in with the bill number, and really doing that research on the specifics. I have to think of it as, in breaking down the meeting, I'm thinking of it as background, then whatever the ask is on the specifics, the rationale, that's probably where the evidence and the data will come into play, and then the action items. What do you need from us? So what bill do you want to sign us to try to sign on to? What issue you want us to try to push on our committee or in Congress? That's all helpful. Specifically, I want to comment on something that Ellen made note of, which was to do your research. I think that's immensely important because, it's one thing to come into a meeting and say, hey, can your boss support this bill, or can they sign on to this? But if you know that the member is supportive of the bill before you go into the meeting, and that they're on a certain committee, maybe you can be like, your ask can be, how can you leverage your relationships with other members on this issue? How can you take advantage of what position you have to try to get your point across? So just knowing those things can be helpful, and really thinking about how you can really make use of that time, because really you only have that 30-minute window. You really want to be strategic in what you put in that window. This may sound crass, but sometimes I think about it as like a 5-25. Like sometimes the first 5 minutes of the meeting, I'm still getting settled. I'm still recovering from my last meeting. I'm trying to figure out what group I'm meeting with, who I'm meeting with. The next 20 minutes, that's where you really have my attention, to really go through those asks, go through that background, and maybe allows time to ask questions. And that last 5 minutes, is the wrap up. To be honest, sometimes I'm thinking about my next meeting, so what I have next. So I really implore you to really focus on that 20-minute window. And then also if you run out of time, we're always happy to, to get more information through follow-ups. As Ellen mentioned, following is always helpful because it keeps you on top of mind when you follow up with us, especially if there is, some evidence or additional research from the district that you're able to provide. And then so follow-ups is immensely critical for us. And then so yeah, so that's kind of like how we kind of think about when you have a chance to meet with us. As Ellen mentioned, out of session is a good time to meet with folks because they're not so inundated with more of the member schedule, and then also they tend to have more free time when it's out of session. And then so that kind of wraps up kind of what the overviews are kind of like going like of how my takes on meeting with personal office staff and committee staff. But I want to really for a few minutes, really just follow up on a few things that Ellen said that I was taking notes on, and that I want to really emphasize that you all are really the experts. Your role here is come educate us, figure out because you know you had the background knowledge, you have that experience. Like if there are times where we're in a meeting or after a meeting, I call Ellen or I call somebody, I'm like, give answer to this, or I was curious about this funding line. Was that really useful? Or what was the feedback from X, Y, and Z? I think that's always a good sign, because we always try to depend on stakeholders or advocates as a resource to know what's going on, because we don't want to be doing policy blind, and so we're really intentional about that. And then Ellen mentioned about respecting each other's views. I think hopefully whatever office you go into either across the aisle, staff normally I think are somewhat respectful, and open, and try to at least listen with an open mind. Not sure if they'll actually take that back, but at least listen with an open mind. And so really just understand too that staff on our end, we have limitations. When you walk out of a meeting, you may not hear the yes, the immediate yes you want, because we need to run things up our chain. We need to do our homework and make sure. So don't be offended if we don't, don't be offended if the staff is just nodding or just asking questions, but they're not really committing to anything, because again, they want to do their homework. And then one more thing, member versus staff level. Again, as Ellen said, please don't take any offense if you request a member level meeting, but you get staff level. It happens all the time, especially if the member has a committee role or a leadership role. Because again, their schedules are packed. And trust me, like the staff would normally convey what's discussed in that meeting. A lot of times staff will either be charged with writing a little memo or a write-up, and they'll send it to their director or directly to the member. So what you're saying does get across to the member at some point. But just know that their schedules just way packed sometimes. And honestly, I think that was kind of everything that I wanted to really run through. Yeah. So again, really appreciate y'all taking the time to really come up to the Hill and talk to us. Again, sometimes we do get trapped into working to a bubble. So it is refreshing to hear those voices, those critiques, those things that we're not doing well. Please let us know. And we're always happy to keep chatting. So thank you so much. Thanks.
Thank you so much, Andre. And now, Elizabeth, we hope you'll jump right in.
Thank you, Terry. Hi, everyone. I'm Elizabeth Newman. I use she, her pronouns, and I'm the Public Policy Director for CCASA, the Colorado Coalition. We have mostly since, I guess I should say, I've been with CCASA since 2021, and in that time, mostly focused my efforts on state legislation. And then, as we faced a lot of both urgency at the federal level with the VOCA crisis, as well as running out of ARPA dollars here to sustain some of those funds for services, we were getting some comments and questions from our state leaders on what we were doing to push Congress to solve this problem, since it is very much a problem that was coming from the federal level. And so we started to reach out to our congressional delegation to really bring attention to the impact of the VOCA cuts in Colorado, and started with a coalition letter from our coalition, the Domestic Violence Coalition, Violence Free Colorado, as well as the Colorado Organization for Victim Assistance. And the three of our coalitions have been working really closely together on advocating for state budget funding. And so we had naturally, evolved this coalition effort to the federal level. We sent a letter detailing the impact to Colorado and the seriousness of this crisis, and the requests that we had for VOCA funding to be, other funding to be found, and sent that to every member of Congress and our senators here. And then we, had our lobbyists actually follow up. So we have state lobbyists, and we have two lobbyists that we share between the three of us. And while they're focused on state legislation, a lot of our members of Congress have been state legislators previously. And so they had some relationships either with folks in their staff office, their district office, or the member themselves. And they helped follow up and request meetings to either with the member themselves or with staff. We got a response from about half of them. And for several of those, they were with a member of staff, which, as we found, and as Andre mentioned, they were really engaged. They took a lot of notes. They were really wanting to understand the impact of VOCA cuts for our state. And then we also had an interest from one of our newer members of Congress, and I do find this to be true, that oftentimes newer members are really engaged to get themselves out there in their community, and they're looking for ways to do that. And so actually, Representative Yadira Carveo, who was in her first term, responded and wanted to do a roundtable in district. So we were able to do that and bring representatives from each of our coalitions, as well as our local rape crisis center. I will say, I think bringing local programs to those meetings was incredibly helpful. It was someone who could say, this is how many survivors we serve. This is how much of our budget, is made up from grants that are through VOCA, as well as how many staff they might have to lay off, or what types of programs they might have to cut back on with these cuts ahead. And that really made a difference in bringing the member to understand what it'll look like for their community. We had state level data and information, but to hear it about a specific program that's in their district, that's serving their constituents, really brought it home in a lot of ways. So I think that was really helpful. I will also say, that those district specific needs, so identifying some of the top issues that are connected to sexual violence, maybe recent news reports, mentioning those and connecting those can be really helpful. So like many places, Colorado is experiencing a lot of behavioral health crises and issues with those funding and services, and the ability for us to mention victim services and our advocacy efforts as being connected and tied to behavioral health issues brought a lot more attention, I think, than, just mentioning, unfortunately, just survivors on a whole. The other thing I wanted to share is we have gotten a lot of feedback that legislators, both at our state and federal level, just really do not understand what victim services are, and the VOCA, kind of the FOCA funding, and how it comes down and how much of an impact these cuts will make. And so, one thing that we have realized, and it was avoiding the words like victim services or crime victim services, and instead giving examples of what those look like and how they impact a survivor's experience towards healing, was really beneficial, as well as describing how much of a program's budget VOCA comprises. I think a lot of legislators think cuts to one source of funding are something that could be made up elsewhere. And when we communicated that for some of our programs, this is 3/4 of their budget, that really, brought home to them, this is not something we can fundraise our way out of. That's because we don't have regular state funding in Colorado. And so we are really at the whim of federal fluctuations in VOCA. One of the other things that was helpful was to mention the VOCA Fix Act, because I do think a number of members are aware of it, and it was important for us to thank them for taking action, but also to let them know it wasn't enough. Another piece of that is also just to thank them for, the work that they've done on issues related to sexual violence. So if they've even just voted for, or if they brought attention to issues that are relevant for our programs or for our movement for survivors, it's really valuable to thank them for what they have done, and kind of encouraging them to move forward and continue to act. And then one of the last things I think that was helpful is that we were putting the pressure on both our state and federal leaders at the same time. And because of the way that this situation is really driven at the federal level, some of our members of Congress were interested in putting pressure on the governor and members of our state legislature to find the funding, and then vice versa. Our governor and members of our state leadership were putting pressure on their congressional counterparts in order to push both of them to say, what are we doing and how are we fixing this? So overall, those kind of combined efforts really help to elevate awareness and ensure that we remain top of mind when it came down to budgets and funding. So I think that's about it in terms of how we've really tried to increase our advocacy around members of Congress. We did also host a funding tour or site visit, and that was actually for our state joint budget committee and leadership. But I do recommend those. It really helped for legislators to be able to see. We did it at a domestic violence shelter, and then we did where they were able to go and tour the shelter and then come back to the administrative offices that are in a separate location. And then we had a presentation from our largest rape crisis center to be able to talk about the importance of their services. And that really did help, I think, connect it as well. And so the ability to see a space always, I think, makes people kind of understand what it's like to seek those services and what goes into providing them. Thank you for the time to talk today, Terry and everyone, and good luck with your advocacy.
Thanks so much, Elizabeth, and thank you, Andre. I don't have to say anything more. I don't think. We're going to go right into our last section of the webinar. And you both gave such great advice and hands-on examples of effective advocacy. So thank you so much. And so I'm going to just sort of try and summarize what you both said and what I was trying to get at the beginning of when I started talking about advocacy is it is so important to give leave behind materials. I might be old school. You can do it. You can email it. You can scan it. You can bring the paper. I'm old school. I like paper. I like handing somebody something. But so that's your leave behind. So they're going to have the information after you leave, and hopefully they will file it away in their sexual assault folder with all other good information. But your story, your talking points, your anecdotes are unbelievably powerful, but effective lawmakers also need to base decisions on evidence, need, data, evaluation, the science. And so it's a 1-2 combo. Some members, like Ranking Member Scott, are, as Andre said, are numbers people. Like, give me the evidence. Just make me understand why this is needed. And then others are like, oh my gosh, I've got so many numbers and evaluations in my head. Please give me an anecdote. Make this real for me. But I think every staffer, every state lobbyist, every federal lobbyist would agree that the combination of both your personal stories and hard evidence is a home run. Next slide, please. So when you're going in to have these conversations, whether at the district level or if you have a chance to come to DC, you really need to make your federal lawmakers understand how critically important federal funding is. I'm going to be honest. We all are honest that we are in a fiscally tight budget situation this year. As Terry mentioned at the top of the webinar, we are there is a law right now called the Fiscal Responsibility Act, which sets specific discretionary spending caps. But we are advocates, and we have to make the case that VAWA, VOCA, and RPE are extremely successful and critical funding streams in our communities. And what these funding streams are helping specifically the unmet needs that victims have, the unmet needs that families have, the waiting list, the waiting list to get into therapy, the waiting list to get into therapy because you don't have mental health professionals on staff. The demand for services is only increasing, as Elizabeth was just saying, and we just have to make this real for the policymakers, even while acknowledging we know we're in a fiscally tight budget situation. Next slide, please. And so the National Alliance to End Sexual Violence has provided on our website all the big picture, we think, infographics, evidence, stats, national surveys that we think will help you and as a leave behind with your members that you meet with. And then, of course, we hope that you will supplement that with specific examples from your community. Next slide, please. So you're going to tailor your talking points. We know that the bottom line is we want Congress to act. We respectfully request that even in a tight budget situation, we must, as strong advocates, advocate for the needs of survivors and the prevention services we know that are necessary to stop sexual violence in every community around the country. And so, key points: how many survivors do you serve? Waiting lists, the needs, what unique things are you seeing in your community? We are past COVID, but COVID is still part of our lives. We're post-COVID. And how has that changed what you're seeing in your community? You're the expert, you're the eyes and ears, and this kind of information is so critically important to your elected officials. Specifically, to reiterate, we want $100 million for SASS, the Sexual Assault Services Program, $1.9 billion in funding for the Victims of Crime Act, $100 million for the Rape Prevention and Education Program, and $30 million for our new Sexual Assault Demonstration Initiative. I believe strongly, I want to leave you with this. I had a meeting earlier today where I had to test this out. I was meeting with a fiscally conservative member, and I acknowledged that I understand the budget caps, but I wanted him to understand the need and the ongoing need in all the victims that we are not currently serving, that he needed to take that into account as Congress makes budget decisions in the coming months.
Great. Thank you so much. And we're getting ready to wrap up now. We hope we've been able to share some information with you that's useful, that you can use the timeline that we provided to think about when and how you want to set up your meetings, use some of the resources, and that you feel empowered to get out there, make your voices heard with your elected officials, who make such a difference in the lives of survivors and who are there because we've elected them. So they really do want to hear from us. We really encourage you to share information about your meetings on social media and let us know how they go. That's so important to us. And before we close, I just wanted to take a moment to thank everyone who helped put this webinar together. A number of people from the NAESV team who are behind the scenes, Maureen and Liv and Camille, contributed greatly. I want to appreciate our contributors and our guest speakers, Andre and Elizabeth, who were wonderful. And I want to thank you all for the work you do every day to meet the needs of survivors and to invest in prevention in your communities. You're such a huge and important part of what we do. Our funding survey infographic is based on all the information local programs gave to us about what you're really facing. We know we have tough times ahead in many ways, but that your programs, your work, your advocacy gives us all hope and gives survivors hope. So we hope you'll do some meetings. We'll hope you'll stay in touch with us. We really appreciate you joining us today, and we wish you the best of luck in your future advocacy efforts.